He's a puncher.
Heidi.
Okay, great. Okay, so today we're going to be talking about incontinence and UTIs. At the end of this in-service, hopefully you guys will be able to describe the different types of incontinence, be able to discuss the importance of incontinence and urinary tract infections, discuss ways to prevent incontinence and UTIs, list and discuss the illnesses and conditions that can contribute to incontinence, and discuss at least 6 ways that you can help incontinent clients in their everyday lives. Okay? So, incontinence, it's the hidden secret. Think about this. Lizzie, as always as an active person, Lizzie, age 49, liked to play tennis and go jogging. It was during one of her jogging sessions that Lizzie felt something dribbling down her leg. She realized that her bladder was leaking urine. Horrified, but not alarmed, Lizzie decided that she should wear a panty liner for future jogging sessions. After all, she thought, she was getting older. So what do you guys think? Would you put up with it and just stay silent and throw on a pad, or would you make an appointment with your doctor?
At 49.
All right, good. Okay, so basically incontinence is not a normal part of aging. Okay, and lots of people think that it is a normal part of aging. There's around 17 million Americans that suffer from urinary incontinence, which is basically loss of bladder control. Few of these people will seek help. Instead, they go to great lengths to hide their condition, not wanting anyone to find out, which is sad. For people, incontinence is embarrassing, humiliating, serious, costly, isolating, but it's also treatable. Okay? So before we start this exciting in-service, bless you, here's some terms to review. Urinary incontinence, or UI, is the accidental or unwanted loss of or leakage of urine, or urinating when you don't want to. It's also known as loss of bladder control. Bowel incontinence, BI for short, is accidental or unwanted movement of the bowels. It's the loss of liquid or solid stool at inappropriate times. The kidneys, most people have 2 kidneys, okay? They act as filters and they get rid of water and waste, like urea and uric acid from the blood, and this waste is called urine. The ureters are connected from the kidneys, they go down to the bladder. And they continuously send urine to the bladder through the ureters. They're slender tubes about 9 inches long. So they're connected from the kidneys to the bladder. The bladder is a hollow muscle that's like a storage tank for urine. The bladder changes shape depending on how much urine there is in the bladder. When the bladder is empty, it's flat and collapsed like a balloon. And then when it is full, it's pear-shaped. Then there's the urethra. The urethra is connected to the neck of the bladder. It's a small, slender tube that acts as a drainage tube. It takes the urine from the bladder to the outside of the body. Sphincters are ring-like bands of muscles that close and open to control the flow of the urine from the kidneys to the bladder and then from the bladder outside. Okay? Urinary tract. Basically, the urinary tract is made up of the upper and the lower urinary tract system. The upper tract is made up of the kidneys and the ureters. The lower tract is made up of the bladder, urethra, sphincters. Men have a prostate gland. An infection of any part of the urinary tract is called a urinary tract infection. The prostate gland is about the size of a walnut. It makes the fluid that carries sperm during ejaculation, and the prostate gland becomes larger as men get older. And then there's the pelvic floor, and it's a group of strong, flexible muscles that attach to the bottom of the spine to the front of the pelvis. And it's often described as a hammock because it holds the bladder and other organs in place. Okay? The kidneys filter about 42 gallons of blood every single day. Kidney or urine is made up of 95% water and 5% waste products. That's taken from the blood. The bladder holds 12 to 16 ounces of urine, about the same amount as a can of soda. A person usually feels the urge to urinate when the bladder fills with 8 to 10 ounces of urine. That's when we get the urge that we need to go. In women, the urethra is short, it's only about 1.5 inches long. And men, the urethra is about 8 inches long. Okay? That's about right. So with incontinence, what happens with incontinence? Basically, let's talk about a healthy bladder. When you have a healthy bladder and healthy urinary tract system, it starts with the brain. The brain controls the bladder and the other parts of the urinary tract system by exchanging messages with the body parts to serve as, using nerves as messengers. So the bladder will send a note or a message to the brain sends a message back that we have to go to the bathroom. As the bladder fills up with urine, its walls begin to stretch. After a while, the person begins to feel an uncomfortable or urge to empty the bladder. So the bladder is sending a message to his brain, letting him know it's time to go. If everything's working right, he can control the urge to go to the bathroom until they find a toilet. If things aren't working properly, that's when accidents can happen and a person will experience a loss of bladder control. Many times, a sudden loss of bladder control is the first sign or symptom that there is a problem, that there's something else going on with that person. The loss of bladder control can happen with just the slightest change in their body. Okay? Then there's different myths of incontinence, and we'll go over these different myths, so don't be a victim of these myths. The myth number one, incontinent is a result of old age, and we talked about that. It's not a normal part of aging. There are some physical and medical factors that can affect a person's bladder, like menopause for women, or an enlarged prostate for men as they get older. Another myth of incontinence is it can't be treated, but it can. It can be treated, there's different ways to treat it, either with medications, with surgery, or with like bladder training. Myth number three, surgery is the only way to treat incontinence. And usually surgery is the last option, especially for older people. There's other ways to treat incontinence. Did you sign in?
Oh, okay.
When you get a chance, sign in and then grab a pamphlet and a quiz. Myth number four, if you're incontinent, it means you've lost your mind. And incontinence can happen to anyone, not just people who have dementia or other mental problems. And myth number five, it's time to buy diapers. Some people think, okay, I'm incontinent, I gotta put a pad on or I gotta buy diapers. And that's just not the answer. And actually diapers can cause more problems, like problems with skin breakdown or UTIs. So you don't wanna just resort to diapers, okay? Okay, so there's different types of incontinence. There's two main categories, transient incontinence and chronic incontinence. So transient incontinence is temporary. It's a short-term condition that can be fixed. It's usually caused by a urinary tract infection or some other kind of medical problem. And once you take care of that medical problem, the incontinence subsides. Chronic incontinence is a long-term condition that can be fixed most of the time, but not always. It's caused by damaged lower urinary tract or a weak pelvic floor, the pelvic muscles. So there's 5 types of chronic incontinence. The first type is stress incontinence, and that's caused by the Poor pelvic muscle control. Women unfortunately get this a lot from having children. Any extra pressure or stress causes the urine to leak out. Okay, so anything like coughing, laughing, sneezing, that's called stress incontinence. Okay, there's 3 levels of stress incontinence. Mild, and it happens like if you're just kind of coughing or laughing and just a little bit of urine comes out, that's just mild stress incontinence. Moderate is if we're walking or making a sudden movement, and if urine, it leaks out, then that's moderate stress incontinence. And then there's severe, and it happens just with any slight activity, just like rolling over a bed. There could be leaking of urine, and that's severe stress incontinence. The second type of chronic incontinence is urge incontinence, or it's called overactive bladder. We've all heard that term before, overactive bladder. That's urge incontinence. Basically, the bladder becomes really hyper. Even small amounts of urine triggers the bladder to send a message to the brain that I gotta go to the bathroom, right? So all of a sudden you feel like you gotta go. The urge is strong and urgent and frequent, and you just can't hold it. And it might only be a little bit of urine. Overflow incontinence. This is the men's, the one that's most common with men. Because of an enlarged prostate, it may cause the bladder not to empty all the way. So the bladder fills up, and then you just have a little stream of urine coming out, just little trickling, and you do that more frequently, the bladder is always full, okay? Only small amounts of urine come out. And this is a bad thing because it can cause a urinary tract infection when you have too much urine in the bladder for too long. And men usually have this because of the prostate getting too big. And then there's functional incontinence. Functional incontinence means someone who might have a physical condition like arthritis or dementia, Alzheimer's. They cannot get to the bathroom so in time. Or an Alzheimer's or dementia patient might not even realize that they have to go to the bathroom, or they might not even remember where the bathroom is. So that's functional. You can't get to the bathroom fast enough and get your pants down fast enough without having an accident. So that's considered functional incontinence. And then reflux incontinence is caused by no urge or sensation to urinate. It's usually people who have had some type of spinal cord injury. They're paralyzed and they cannot feel from the waist down or the neck down. So that's reflux. Just don't feel that. Okay? Anyone have any questions about that? Okay. So incontinence affects all kinds of people. It affects children, adults, and the elderly. First of all, with children, incontinence in children is mostly in the form of bedwetting. As many as 7 million children wet their beds at night. And more often than not, it's boys, more often than girls that wet their bed. My son wet his bed. He would die, but if you heard me say that. Incontinence is a common problem that most children will outgrow as their bladders develop and grow bigger, okay? If bedwetting continues past 5, you should probably contact the doctor about that. And only 1% of teenagers over 16 have trouble with nighttime incontinence. And bedwetting tends to run in the family. 70% of children who have this problem also had a parent or close relative who wet their bed. And then many children with disabilities or birth defects have incontinence too, or bladder control problems. Okay, so incontinence in adults. It can happen at any age to both men and women. Women experience, like I said, because of childbirth, pregnancy, and then menopause. During menopause, we lose estrogen, so that affects our bladder and our bladder control. And also because we have a shorter urethra, so we have more chances of a urinary tract infection. Stress incontinence is the most common in women, okay? Most men who experience incontinence do so because of their prostate gland is enlarged. Studies show that men seek help for incontinence after about 1.5 years, but women, they put up with it for about 3 years before seeking help. So that's kind of interesting, because most of the time it's hard to get the men to go to the doctor in the first place. Okay, incontinence in elderly people. This pertains to us a little bit more. Bladder sensations change with age. So the elderly person might not feel the need to urinate until the bladder is almost full. Whereas most younger people, we feel the urge about 8 to 10 ounces, remember? And the bladder holds 12 to 16 ounces. So we start feeling it before our bladder is completely full. Whereas an older person, they're gonna feel it more likely when it's almost full. Also, their bladders get smaller as they get older. So not only are they not feeling it till it's almost full, but then they can't even hold as much because their bladder is smaller. Also, as people get older, they produce more urine at night. So 2/3 of the fluids that people drink during the day are made into urine at night. And that is because when people are laying down, the kidneys can make urine faster because there's just more blood flow to the kidneys, okay? So more bathroom trips are common at night. Urge incontinence is most common in people over 60. 4 out of every 10 women and 2 out of every 10 men experience urge incontinence. Okay, and urge incontinence, remember, is the one that is the overactive bladder. You know, all of a sudden you just feel like you have to go. Incontinence is one of the major reasons that elderly people are put into nursing homes, only second to dementia. So that's sad to think when you think about that. Okay, so different illnesses that can cause people to have bladder problems. First of all, Alzheimer's disease or dementia, and that would fall under like the functional incontinence. Alzheimer's is a disorder of the brain with the main characteristic is dementia, which is the loss of mental abilities or loss of memory, loss of language, loss of judgment, loss of the ability to do everyday activities. So it happens in the later stage. Incontinence happens in the later stage of Alzheimer's. They just can't remember what a bathroom is. They don't remember what to do, right? They don't know where the bathroom is. Stroke. A stroke happens when a blood vessel that feeds the brain gets blocked, or the blood vessel can burst, and then that part of the brain is affected and doesn't work anymore. So many stroke people don't realize that they have full bladders. So that's the reflex incontinence. They just don't feel it, right? Or it could be functional incontinence because they cannot move well enough to get to the bathroom in time if they have paralysis on one side or the other. Diabetes, I forgot Parkinson's. Parkinson's is, it's a brain disorder that affects the central nervous system. The main symptoms are shaking, rigidity, slowness, and unsteadiness. So it makes it difficult for the patient to get to the bathroom in time, and muscle weakness can affect the sphincter, causing incontinence. Okay, walkers and wheelchairs also make trips to the bathroom difficult. So, but that means functional incontinence. Diabetes is a disease which the body can't control the amount of blood sugar. It can cause frequent urination and frequent UTIs. Diabetics get UTIs more often. There may be nerve damage over time from high blood sugar that affects the bladder, and diabetics may lose the sensation to empty their bladders completely. So when you lose your sensation to empty the bladder may not empty all the way, which then that urine sits there and it can cause urinary tract infections. The diabetic client might not even realize that they have a full bladder because they don't have that urge to go. They don't have that feeling. Okay, arthritis. This causes functional incontinence. Arthritis, you have sore or swollen joints, which cause you pain and stiffness, and it makes it difficult for people to get around, so they might not be able to get to the bathroom in time. because it's painful or they're slow and they can have an accident. Multiple sclerosis, it's a disease of the nervous system. They're not gonna feel that their bladders are full. So they can have overflow incontinence or overactive bladder, okay? And interstitial cystitis is usually found in women, and it's a problem with the bladder that it gets really tender and easily irritated, and it's even painful. So they have urgent and frequent urination with this interstitial cystitis that, lucky us, only women get. Any questions on that? Okay, urinary incontinence and urinary tract infections. Okay, urinary tract infection is called cystitis or a bladder infection. It's a common problem, only secondary to respiratory infections. Each year, about 10 million people visit the doctor for UTI, and most of them are women because our urethras are shorter, right? Women have shorter urethras than men, make it easier for bacteria to spread through the urinary system. Having a UTI is a sign that there's a bacterial infection somewhere in the urinary tract system, somewhere in the kidneys, in the ureters, in the bladder, or in the urethra, okay? Once discovered, the urinary tract infection is treated with an antibiotic and the symptoms usually go away. If left untreated though, the infection can damage the bladder and the kidneys. So do you guys know the symptoms of urinary tract infection? What are some of the symptoms?
The dark color, smell.
Pain and burning.
Pain and burning.
Have chills, fever.
Fever, yep.
All right.
Okay. For many elderly people, incontinence is the only symptom of UTI. So if you have a patient that all of a sudden is incontinent and they've never been incontinent before, then you might want to suggest to the doctor or to the case manager that, have them check for a UTI and see if there's other symptoms. Okay. Also, increased confusion in elderly people is a sign of a UTI. So that's something to think about too. If all of a sudden the family's saying, she's not acting right, most likely it's a UTI. For women, UTIs can be caused by not urinating often enough or poor hygiene. Menopause can cause UTIs, diabetes, and men can get UTIs because they're of the enlarged prostate, okay, which causes their bladder not to empty. Many incontinent people have chronic UTIs because they're always wet, causing the bacteria to grow. So the use of catheters to help control the incontinence can also cause UTIs. So like if they're always wet, their pants are wet or their diapers are always wet, the bacteria lives in there and they can get a UTI. If you got a client who's cathing himself frequently and they're not washing the catheter, then that can totally cause UTIs too, because they're sticking that catheter up their urethra to empty the bladder, and then the bacteria goes up the catheter. So with Medicare, if you have a client who's doing straight casts frequently, you want to encourage them to do it like 3 to 4, at least 4 times a day, 3 to 4 times a day, so that the urine doesn't sit in the bladder for too long, but also to always use a new catheter. And Medicare will provide, I think, like 150 catheters per month to the Medicare patient. Those are just the straight little tubes. You guys have ever seen those? Like for patients who just straight cath, just to empty their bladder and then take it out, that's what we call straight cath. It's just a,
They do it themselves.
they can do it themselves. Most of the time people can do it themselves.
Oh.
Or the families might do it. Does that sound like fun?
No.
I know what you're thinking. I know it.
But see, that's the problem. They don't do it often enough, so that urine sits in there too long, and then they can get an infection. But yeah, it's just a straight catheter. It's about so long, right? You've seen it. And then they just lube it up and cap themselves and empty the urine.
then dispose it.
and dispose it.
Okay.
Yeah, it's for people who have blockages, mostly men. And a lot of times you're women with multiple sclerosis and stuff, where you have damage to the nerves that they can't empty their bladder. So,
Okay.
but always use a new one. You've got these older patients who are trying to save money or something, and they want to wash it with soap, right? Yeah. Tell them not to, that they get $150 a month. So, that's more than enough. That's like 5 times a day for 30 days.
They just don't want to be wasteful.
I know, but it can cause, more cost because they're going to the doctor and having to take antibiotics.
But in that case, why they just don't leave the catheter in there?
Because when you have an indwelling or a Foley catheter, there's more chance of infection with that too, because, because the catheter's in there all the time, and then there's just chance of bacteria going up the catheter, because that's an opening up to the bladder through the catheter. So it just depends on the situation. You know, your clients with Foley catheters, they always have a chronic UTI. Catheter patients do. And usually the doctors don't treat it unless there's an actual symptom. They have fever, or the urine's really, really cloudy, or there's, really screaming bad symptoms.
And that's the reason that they end with that. After having so many infections, I think that's the reason that they put it directly to the bladder, right?
Oh, the
Is that the
suprapubic
reason?
catheter? Suprapubic?
Yes.
So the suprapubic catheter that she's talking about, it goes right into the bladder
Right.
through the lower abdomen area. And that's usually for people who are gonna have this catheter long-term. They're just gonna have it for the rest of their lives, for whatever reason. I don't think it's any less risk for infection, because it's still it's an open path to the bladder through that catheter. It's just easier for them to deal with. They don't have to sit on it, right?
I see.
It's easier access, but that's a suprapubic. That's for people for sure, long term.
Right.
Yeah. Okay, so different conditions that can lead to incontinence: pregnancy and delivery of babies, menopause, because we lose our estrogen, and with the loss of estrogen, it weakens the bladder and the other muscles. Medications can cause incontinence, like painkillers, sleeping pills, narcotics, diuretics. You all know your patients with the Lasix, right? Constipation caused by the painkillers can also cause incontinence, because a full bowel pushing on the bladder can cause incontinence. Smoking can cause incontinence by people coughing really hard as they're taking a puff of their cigarette. That can weaken the muscles. Obesity can cause extra pressure on the bladder and the urethra. Low fluid intake. This is an interesting one. By not drinking enough water, that irritates the bladder, which then can cause incontinence. So your older people who say, I don't want to drink water because I'm afraid I'm going to go to the bathroom, they're just doing more harm to themselves. So they need to be drinking about 6 to 8 glasses of fluid per day, unless they're on some kind of fluid restriction from the doctor. But 6 to 8 glasses of fluid. So when we say fluid, that includes juices and coffee and waters and stuff like that. And then high impact exercises can cause incontinence, like gymnastics, karate, tennis, jogging. Those all cause extra pressure that can push on the bladder. Okay, so the different ways to treat incontinence, like I said, men wait about a year and a half to go to the doctor. Women wait about 3 years to go to the doctor to talk about their incontinence. The doctor might order different tests, like stress tests or urinalysis. We're going to order a urinalysis to make sure that the patient doesn't have a urinary tract infection. They might do blood tests. They might do an ultrasound of the bladder, or a cystoscopy, which is a little camera that they look up and see the inside of the bladder and the urethra to see what's going on. Depends how they treat the incontinence, depends on the type of incontinence the person has and how bad the symptoms are. Surgery and medications are common ways to treat it. Also, Kegel exercises are another way to treat it, and those are for helping the weak muscles. Kegels will help strengthen those muscles. And they're talking about behavioral therapy is a way to treat it. Behavioral therapy is like training programs where you can use the toilet, you teach your people to use the toilet at certain times. Every 2 hours, get up and go to the bathroom. And that will help prevent some incontinence. Time toileting. Surgery, doctors usually do this as a last resort because there's lots of complications that can happen from surgery. Okay. Many drugs help control incontinence, but there's like Ditropan. I'm sure you guys have heard those. What was that one commercial? Gotta go, gotta go, gotta go. I think that was a Detrol. That was years ago. But with medications, there's side effects. And then there's biofeedback, and this teaches people how to listen to their bodies and change their habits by using computer equipment and measuring devices. How many older people are going to be using biofeedback? And it's just not realistic. So those are your different ways to treat incontinence. But I think the main thing is going to the doctor and then just checking it out. So if you got a client who has incontinence, encourage the family to call the doctor. Okay, so tips for handling incontinence. First and foremost, be really, really patient and understanding with your client, and families need to remember to be patient and understanding too, because no one wants to have an accident. There's a reason that they're having these urinary problems, and they don't do it on purpose to annoy anybody. When your client says they have to go to the bathroom and ask for help, make sure you take them right away, because remember, they don't feel it until their bladders are full. So when they say, I gotta go, that means they gotta go now. It's kind of like our kids when we were potty training them, right? All of a sudden you see them dancing around and they're going, right? At the very beginning, because they're not feeling it. They're not feeling
like nursing homes or walking down the
I was
aisles.
thinking about that.
Yeah, like when you're walking to see a patient and then you'll see other people, I need to go to the bathroom, or that's the most common thing that I hear.
Somehow, yes.
I know.
I can't
And do they not, are they sitting in a wheelchair or something?
Yes.
Yeah.
They even ask us sometimes.
And then they'll go like this, you just have to pass right by them, or,
See, and then I would be running around looking for the,
I
the
do a
person,
lot of
I mean,
times.
so-and-so needs, I feel
I
bad.
do a lot of times.
but then they're like, oh, she always
But
does that.
sometimes they don't do the stay
But see, that's sad, because she probably has to go,
Sometimes they don't pay attention, they'll say wait.
I
Or
know,
some of them, they will come, they'll say, okay, I'll be right back, and they never come.
I know,
Can't do nothing.
yeah.
That-
Yeah, that's the hard part, and this thing is kind of geared towards like nursing homes, because it's saying, good care in nursing homes, which it says, okay, remember, it's important to toilet your client on a regular schedule. For example, good care in nursing home means that each client is toileted on a regular schedule according to an individualized care plan, special to that client. See, the problem is they don't get that. I don't think they do. So if a client needs toileting every 1.5 to 2 hours, then it needs to be done. But they're too busy. I think they have too many patients to take care
Right.
of. That's
It's
the
like
big
a
problem.
overload. You can see it, sense the overload.
Yeah. But if you're like in a home, helping out a family and they have paid caregivers, maybe teach them that, if it comes up, of something about it. If they're incontinent and you guys are going in and their pants are always wet, or their diapers are wet, or their skin's excoriated, you can teach them different ways of taking them to the bathroom every hour, every 2 hours. For clients who can go to the bathroom themselves, make sure that there's a clear path to the bathroom. Okay, so it helps prevent falls, and they can get in there and not have an accident. Also encourage your families to place night lights along the path to the bathroom, so in the middle of the night if they have to get up, hopefully the night light will help prevent falls. Make sure the clients can easily use the toilet paper, or the toilet. Is there grab bars, is there a raised toilet, so that they can easily use that toilet. Encourage your clients to wear clothing that's easy to remove, easy to take down, so they're not messing with buttons and zippers and everything real fast. Is everyone being reminded of something right now?
Yes.
I hope it's not for this in-service, because it's late. Let's see. Alzheimer's patients and dementia, you might have to place the word toilet on the door, you know, or a picture of a toilet, so that it reminds them where the toilet is. And you probably have to remind Alzheimer's and dementia patients to use the toilet every 2 to 3 hours, and help them with their clothing. They might not even remember how to pull down their pants, right? If you have to use absorbent products, make sure you change the pads or the diapers regularly to prevent any skin breakdown. If they're left in a wet diaper, they can get rashes, they can get pressure sores, they're a higher risk for urinary tract infections. Changing your client's pad or diaper on a regular schedule will also help prevent the smell of urine from being in your facility. See, it says facility, so that's back to like a nursing home. If you can smell urine, then you know that every client is not getting the toileting help that they need. So, we've all
Everything
smelled
else.
urine. What did he say?
They all.
Everywhere.
Maria, this morning, a heavy, it was
Yeah.
saturated.
Yeah.
Was it like a pad or a diaper?
It was
Right.
a diaper.
And it was totally heavy?
Yeah, we went to, give us a bath, and when we saw it, I think it was just heavy, and, I mean,
Yeah, that's
like
not, that was from,
2 pounds.
that was probably from last night, like around 5 o'clock at night.
Or
or
if there's
something.
urine all the way to their neck.
It fell apart. Remember, it fell apart.
And you guys, urine's really damaging to the skin.
We were thinking about
Yeah.
pieces on the floor.
Yeah, urine's really damaging to the skin, and it can cause like sores and rashes and infections. It's important to wash the skin with a mild soap like Dove after urine or bowel incontinence. That's what it says here. I think they just said Dove because it's mild,
Okay.
but any mild soap, okay? Alrighty, so let's, good. Okay, more tips for handling incontinence. After washing your client, it's best to let their skin air dry rather than rub it. Do you guys agree with that? Rather than rubbing the skin? This will help avoid skin tears and irritation. Remind your client to use the bathroom right before bedtime, just like we did with our kids. This helps to prevent nighttime accidents. To cut down on odors, you can keep the windows open for fresh air if possible, or use deodorizers. And keeping your client as dry as possible will help with odors. Always clean your client carefully after each bowel movement. For women, wipe from front to back. You guys all know that, right? Front to back. Because we got these short little urethras. And that helps prevent germs from the stool getting near the urethra. If your client uses a bedpan, try warming it by putting warm water inside and along the rim before use. And also you can sprinkle some talcum powder or cornstarch on the edges so they can slide on it easier. I don't know if you guys use bedpans too much. For clients who use catheters, we talked about this. Avoid infection by washing their catheters in hot soapy water, but this is old. They are provided with 150 catheters per month, so you don't have to, if they're gonna do it, then they need to wash it in hot soapy water. But I've seen too many people set it on a little piece of paper towel, right on top of their sink, after, Store catheters in a plastic bag or container. Please note, catheters can be boiled, but not microwaved.
Yes.
Oh my God.
What is the difference? Imagine.
The microwave isn't good for the plastic.
Oh my God.
Yeah, you don't want to
Put
microwave.
You can put your food in there.
I can imagine.
You know what's sad is they probably do that
To save time.
to save time. And then notify, if you have a patient with a cracked or brittle catheter that you see them using, you guys might notice some catheters now in the homes, now that we've talked about this. If you see an old, cracked up, brittle catheter, tell your case manager. It's time to have it replaced. If you do have patients or clients who self-catheterize, don't let the bladder get too full, like I was talking about. Encourage them to do it frequently, okay? Let's see, if your client has a Foley catheter, watch for signs of a UTI, fever, chills, lower back pain, cloudy or red urine, and for leaking or swelling around the area where the catheter is inserted. Let your supervisor or case manager know if there's any changes. Encourage your client to drink plenty of liquids, at least 6 to 8 glasses of liquid per day. And have them drink the liquids throughout the day, not all at once, because all at once is going to irritate the bladder too. So just throughout the day, just drink. Also, without enough, if they don't get enough liquid, they could get constipated, and constipation can cause incontinence too, because that stool is pushing on the bladder. If you cook for clients, fix them foods with high fiber content like brands, whole grain breads, fruits and vegetables, leafy greens. Try to limit gassy foods like apricots, bananas, beans, cabbage, onion, milk, and milk products, prunes and raisins. How interesting. No prunes and raisins.
And the wrong stuff.
Because the prunes and the raisins cause gas, which can make the bowel bigger, and then it pushes on the bladder, because the bowel is kind of running close to the bladder. But we use prunes all the time for constipation, so. Foods that can cause urine leakage, alcoholic drinks, which includes wine and beer, carbonated drinks, citrus fruits and juices,
Everything.
grapefruit and orange juice, spicy foods,
Oh,
artificial
wow.
sweeteners, and get this last one, tomatoes.
So what are they gonna eat?
I
I think this is something to think about if you got someone who has a problem with leaking
Yeah.
urine. Okay, just a few more tips and then we'll take our test. Constipation is bad for another reason too. Straining to have a bowel movement can cause damage to the pelvic floor muscles and nerves, right? So those weak pelvic floor muscles cause incontinence. Try to set up a routine bowel schedule, such as 20 minutes before or after breakfast. After breakfast or dinner. If a client is having trouble with constipation, suggest a glass of warm water to help with bowel movements. Laxatives and enemas should only be used as a last resort. But I think like something natural like warm fruit juice is fine. Encourage your client to pay attention to their urge to have a bowel movement. If they wait too long, they say, no, I don't want to go right now, it can cause constipation. And it's also to toilet clients when they ask for help promptly. If you're busy with another task, take the time to take the client to the bathroom. Encourage your clients to limit caffeine. Caffeine is a natural diuretic and it irritates the bladder. So drinking a lot of coffee and tea will cause frequent trips to the bathroom. Depression is a common problem for incontinent people. So if you see signs of depression, including weight loss or weight gain, lack of energy, overwhelming feelings of sadness, anxiousness, sleeplessness, loss of interest in activities, thoughts of suicide, let someone know, okay? Help your client remember when to take their medications. And if your client's having problems keeping track of their medications, let your case manager know. Exercise is important. Encourage walks whenever they can walk or as often as they can. Teach your client to do the Kegel exercises. And that will help them to build up their muscles, and it might help mild to moderate stress incontinence. Okay. Nursing assistants are responsible for meeting the personal care needs of their clients. Your job can be overwhelming, especially when you have 25 clients or more to look after. Thank goodness you guys don't have that, right?
Wow.
Okay, so some tips, some ways to prevent UTIs: washing your hands before providing personal care, wearing gloves when cleaning the genital areas, which I hope you guys are all doing that, right? Cleaning from front to back so germs from the bowels don't get into the urinary system. That's it. Anyone have any questions? Okay. Alrighty, so you guys want to go around the room and do the test? Do you want to start?
Number 1, incontinence only happens to old people in nursing homes? False.
False. Good.
Incontinence is a normal part of growing old. False.
False.
At 85, Mrs. Smith has always had control over over her bladder. But just yesterday, she wet her pants on the way to the bathroom. You should letter B, help her clean up and report the problem to your supervisor.
Right. Because like we were talking a lot of times, incontinence, if they're not usually incontinent, and then all of a sudden they're incontinent, it could mean that they have a urinary tract infection.
B.
So it's B. Yes, that's reported to the supervisor, or to the case manager, or to the doctor. Number 4. Your turn, Vince.
Mr. Jones, age 69, complains that his bladder never feels empty and he is leaking urine all the time. You should tell your supervisor because Mr. Jones could have C.
Overflow incontinence. Right. Good. Sylvia, you want to go?
Incontinence is treatable.
It's treatable.
That's good. That's a very positive statement. True.
There are many different types of incontinence. True.
True.
More men than women have problems with incontinence.
True.
False.
False.
Women do.
More women do. Yep. Okay. Do you want to go, Maria?
Okay.
Number
8.
9.
8.
8. I'm sorry.
Incontinence can be a symptom of a urinary tract infection. True.
True.
Yeah. That's right.
Catherine.
Nice.
People who are incontinent should drink less fluid to keep their bladder from getting full.
False. False.
Adult diapers should be used only when other treatment methods have failed.
True.
False.
I think it's true. Let me look at that. Yeah,
Last
true.
resort.
Yeah. Adult diapers should only be used when other treatment methods have failed. So, true. You don't want to just stick the diapers on them right away. Hey, she never